So, Kavi is working towards her pathways, which is in presentation mastery. And tonight's speech is evaluation and feedback number 2. So, I believe she's just redoing the speech that she did the first time by applying the feedback that she received from her first speech. And this is a 5 to 7 minute speech. The title of her project is Investigating the Cause of Chest Pain in Postural Orthostatic Tachycardia Syndrome.
I'm just going to quickly preface this presentation here. Last time when I did this presentation, I did ask everyone for feedback as I wanted general audience feedback as this is something I'm going to be presenting at a conference. And a lot of comments were about the slide, so I just want to clarify that this is actually a poster presentation. So I have this giant piece of paper that is printed. So this time I'll zoom in a little bit as I'm going through the speech so everyone can actually see. And now I'll start my speech. So my poster is talking about investigating the cause of chest pain and postural orthostatic tachycardia syndrome using myocardial perfusion cardiac MRI imaging. So what is POTS? POTS is a condition characterized by an increase in heart rate when these patients stand by at least 30 beats per minute. And it's also associated with many chronic symptoms, such as lightheadedness, mental clouding, and chest pain. And this condition mostly affects women of childbearing age. They're typically on the younger end. I'm specifically focusing on chest pain because previous studies that we've done have shown that it's a very common and debilitating symptom for these patients. Many of these patients have experienced it as if they're experiencing a heart attack, but when they go in for testing, typically they get heard that their heart is okay and they're not experiencing a heart attack, so then they're left wondering why they're experiencing this chest pain. So my project is looking at what is actually causing the chest pain in this patient population. And the way I'm doing this is using a cardiac MRI, which is the MRI of the heart. I'm specifically using a drug called adenosine in this MRI. The purpose of adenosine is to essentially induce exercise in these patients. When we induce exercise, we would expect more blood to go into the little vessels of the heart and to supply the heart tissue because it needs more energy. So what we expect in these patients is that when they're under this medication, that there's going to be increased blood flow through these little vessels to actually supply the heart tissue. If we're not seeing as much of an increase in blood flow as we expect, that's probably what's causing the chest pain in these patients with POTS. So once these patients underwent the MRI, we have a bunch of images. And I have examples of the images here. Within the images, we see some bright areas within that red circle here, and that bright area is actually highlighting a contrast in the blood. So the contrast highlights the blood so that we're better able to see where the blood is moving. So we can see, is the blood just sitting in the heart or is it actually moving to the heart tissue? So if we look to the right here, we see a series of different colored lines, and the different colored lines highlights different portions of the heart. And what we'd expect is during rest without any medication, we would expect a certain portion of the blood to go into the heart tissue, but when these patients are under the effect of the medication, we would expect a lot more blood to go into the heart tissue. So what we're looking at here is the slope, which means the change in that contrast going from the heart to the heart tissue. So our top row here is during rest, where we have a medium amount of slope, and then in the second row here we see that the slope is a lot higher, and that is what we would expect as more blood is going into the heart tissue during that increased demand of exercise. When we're moving on to the results, the main thing that we're looking at is the slope, so the change in the blood during the two conditions, and I'm looking at this change in 3 main arteries of the heart. So these 3 main arteries are the biggest vessels that supply blood to the heart tissues, and I'll be comparing the slopes between these 3 main arteries. So moving on to the results. This is some preliminary data, so I am only showing data for 13 patients and 5 healthy controls, but I would like to note that these POTS patients and healthy controls were sex matched, so they were both all females, and they were very closely age matched as well. They were age matched within 3 years of each other, and as we see the mean age here, the mean age was about 28 years for each group. Moving on to the results here. So here I'm showing the MPRI, which is the slope that I was talking about earlier, and we're seeing whether or not that slope is different between the patients with POTS and the healthy controls. And here we're seeing that the slope was not significantly different in any of the 3 main arteries or also overall in the heart. But what's interesting to see is that if you look at the bars of the POTS patients, they are lower in each of these graphs here. So going back to the fact that this is preliminary data, we do only have a small number of patients and a small number of healthy controls right now, but seeing that there's a trend of decreased slope, it's very possible that we just don't have enough patients to look at the statistical significance of our data, and it very well could be that there's not enough blood going into the heart tissue when these patients are experiencing fast heart rate that could be causing the chest pain. Next, I'll just briefly go over the project and some considerations that we made. This project was actually in collaboration with the biggest patient advocacy organization for POTS, as they really highlighted that many patients experience chest pain, but we don't know what's causing it, and how this can be very frustrating for these patients. So this idea for this project did actually come from this organization. And because we were working very closely with these patients, this protocol for the MRI was actually tested through these patients first to make sure that it was tolerable for these patients before we go ahead and recruit our many patients that we want to recruit. And lastly, for considerations, I do want to preface that right now we do only have females, but that is expected as over 90% of patients with POTS are actually female. But we do want to do some more specific analyses, so we're actually assessing gender on a scale, and once we have more patients, we will actually have more gender-specific analyses to see if there's any differences in our results with gender. So overall here, it seems like the amount of blood going to the heart tissue during periods of high demand could be decreased in these patients, but we will need more patients overall to figure out whether or not this is the true cause of their chest pain. Thank you.